And now on the line is Paul McAuliffe. Paul, as probably most of you know, is the McAuliffe TD for Dublin North West. Paul, welcome back to Near FM.
It's great to be back always on a great local station.
Alright, cool. Paul, I read a couple of articles in the Northside People in recent weeks written by Mike Finnerty where he quoted you as saying that Dublin North West needs considerable more public healthcare funding, and only recently there has been more allocation of healthcare funding across the country. Can you tell me, Paul, what you believe Dublin North West needs in terms of healthcare funding? And then can you tell me if you are happy with the recent announcement of funding to your constituency?
Yeah, so I suppose we were very conscious that the HSE capital plan was due to be published at the end of February, beginning of March. And in advance of that, I suppose there were 4 or 5 projects in my area that I was really sort of passionate about and wanted to make sure they were in the HSE capital plan. So I might just go through some of them. As you know, Dublin North West, our constituency goes everywhere from Kappa Hospital over in the west to Beaumont Hospital in the east and everywhere in between. So let me talk about those 2 hospitals first of all. Like Beaumont Hospital is a huge hospital. It caters for really important district of North Dublin, and I was delighted to see within that 24.6 million, so one of the largest allocations of funding for Beaumont Hospital. Now, Beaumont Hospital is a great hospital, but it has a lot of things that need to be improved. So some of the plans in there is a new cystic fibrosis unit, a new critical care unit, an extension of beds and ward beds, and also an A&E department. So there's a number of projects happening up there in Beaumont Hospital, and that €24 million will cover a large number of those. The cystic fibrosis unit is due to be completed later this year. So that's a really great development for Beaumont, but I think there's still a lot of work to do. And I know people's experiences sometimes in the A&E is still difficult. And there's a number of your local TDs that are pushing the Minister for Health very hard to make sure that we continue to improve Beaumont. There's 2 primary care centres, so we obviously have the Finglas Primary Care Centre and the Ballymun Primary Care Centre. So we know that the health service is pushing more and more health coverage into a primary care setting, so you don't have to go into an acute hospital. So that there's 6.4 million that's included for the Finglas Primary Care Centre, and then there's a 7.7 million for a refurbishment of the Ballymun Primary Care Centre. Both of those, I suppose, are projects that are really needed, and they service a much wider area. Anybody that knows that they're going to VDOC, they might end up in Ballymun in the evening time. So that building is part of that. And also we hope on that site really close to it, there's a service for people with acquired brain injuries in Santry at the moment called On Sale, Jock on Sale. And we hope that there'll be a brand new building there for those people who've had an acquired brain injury. And then the last big project is the National Orthopaedic Hospital, Kappa Hospital, and there's 5.6 million for the construction and design works at the National Orthopaedic Hospital to improve facilities there. So over 44 million in total, which is a huge amount of funding into the area. It will certainly improve the services that are there, but they do need to be improved, and I want to see this and more delivered over the next couple of years.
Just a couple of quick follow-up questions, Paul. Like, as regards to Finglas and Ballymun primary healthcare centres, I agree with you that they're a fantastic service, but like, is it going to be a case, do you think, of when they come on stream that there'll be huge lack of staff, or what do you think?
Well, the primary care centre in Finglas particularly has had a lot of difficulties. You know, it had some planning issues, and then it was delayed. Other centres were put ahead. So it is. They hope to break ground later this year on. They've to move a number of sports facilities connected with Colossus to Ida. So there's still a way to go. In those primary care centres, the big issue is that it's hard to attract GPs to open up in places like Finglas West or Ballymun. in areas where there's high number of medical care patients, because doctors find that the cost outweighs the income that they can get. The idea is if you open primary care centres, doctors will come to you because they don't have to manage their own facilities anymore. They don't have to have costs of insurance and security and all of that. But definitely we think that there won't be a shortage of GPs either for the primary care centres in Finglas when it's opened and the one in Ballymun. The other things like the chalk on sale, which is for those people with neuro rehabilitation. There is a service that's going in with chalk on shield, and that will give a neuro rehabilitation team for all of the north side. They're recruiting for that at the moment, so hopefully by the time the building is built, that recruitment will be successful. But at the moment, because the economy is doing well, because there's lots of jobs, recruitment is a challenge in every sector. And I suppose the HSE have to keep just working hard to make sure that they recruit those people.
And can you tell me, Kappa Hospital? I've never been there. That's compared to other hospitals in Dublin. That's a small hospital, isn't it?
Yeah, I suppose it's a small hospital and a big hospital at the same time because it's a national hospital for orthopaedics. So for issues around scoliosis, issues to do with the spine, other orthopaedic related issues, particularly for children, it's a really important centre, and they do a lot of national work. And also, as you say yourself, it's not a general hospital, so people don't tend to go into it like you would into the Mater or Beaumont, so people aren't as familiar with it. But it's there a long time. It's a national centre. They operated right through COVID, and they seem to be able to do that work. Obviously, there's significant issues around the current investigation into CHI and the issues around a number of orthopaedic related incidents, but I suppose, I think you could still invest in the hospital while still dealing with those issues, and there is an inquiry into those. So, not as well known, but they do very important work for children. And as we've seen, you need to have those facilities in place.
I'm not sure if you said this as a start of the interview, but Kappa Hospital, they got increased funding as well, did they?
They did, yeah. I think it was over 7.7 million for Kappa Hospital, and they have the old, what they call Nightingale style wards, where there might be 10 or 12 people in a ward, and people are all lined up. That it's to try to replace some of those wards that are still there, which is really, really bad for infection control and things like that.